utilize the cable machine. To perform the exercise, what you need to do is attach the resistance band or the TheraBand to a pole, just shy of chest height, or attach it to a door handle, wrap it around the handle. Okay? If you're in the gym, set the cable machine to the same position that you would with the pole, just shy of chest height. Okay, to perform the exercise, what you want to do is come over to where the band is attached, holding onto the band with your two hands out in front like so. Your feet should be shoulder width apart and nice and relaxed in the shoulders, okay? So this is your starting position. You then want to gently squeeze the band towards your body, bending at the elbows, and you should feel a nice squeeze behind the back of your shoulder blades to the middle portion of your back. Hold this position for about 3 to 5 seconds and slowly return back to the initial starting position. Okay? You repeat that, holding for 3 to 5 seconds, and then returning back to the starting position. Okay? To progress the exercise, what you can do is increase the resistance of the resistance band, go up to the next color or the resistance. You can increase your sets and reps. So ideally you start off with something like 8 repetitions and 3 sets of that. You can progress somewhere to say 12 to 15 repetitions and 3 to 4 sets. Okay? If you feel like the resistance band is too much, you can always regress the exercise and perform it without any resistance bands. The next exercise is the shoulder blade squeezes. To perform this exercise, you will need a resistance band or a TheraBand. You can actually perform it without the band, but for today's demonstration, I'll show you with the band, okay? So to do this, what you want to do is stand up nice and tall with your feet shoulder width apart. Nice and relaxed in the shoulders. You're going to bring your hands up towards shoulder height out in front of you. Not much tension on the band, and you're going to pull the band apart, and you want to be feeling a nice squeeze through the back of your shoulder blades. The best cue that I sort of use is imagine a pencil is between your two shoulder blades and you're trying to squeeze that pencil together nice and tight, okay? So we'll start off with the band out in front, pulling out to the side, getting a nice squeeze between your shoulder blades, holding that position for about 3 seconds, and then slowly coming back. When performing, you want a slight bend in the elbows, not too straight, otherwise you'll put more strain through the front and the back of your shoulder where you shouldn't be feeling it. Okay, so we'll go again with the exercise, pulling the band apart, getting a nice squeeze behind the shoulder blades, holding that for 3 seconds, and then coming back to the starting position. To start off with, you want to be trying to hit around 8 reps to 3 sets, and as you get more comfortable and more strong through the shoulders, you can sort of progress on towards sort of 10 to 12 repetitions and maybe adding an extra set in there. I'm now going to demonstrate the bow and arrow exercise. To perform this movement, you can do it at your desk in a seated position or also in standing, okay? So to do this, we want to be working your mid-thoracic, and we're trying to mobilize the joints of the back to get them moving more freely, okay? So to start with, what you want to have your feet nice and flat on the ground, sitting up nice and tall. Your hands should be out in front like so, not too high, just at shoulder height. And we'll start off with the right hand side. You maintain the left hand side forward. You want to rotate your body, your mid-thoracic, as far as you can to the right, keeping your lower back and your hips nice and straight, as far as you can go, and then coming back to the starting position. You'll then repeat that on the left hand side, nice and slow, rotating to the left through the mid-thoracic, keeping your hips nice and straight and level, and then returning back to the starting position. Same thing again on the right, opening up, holding that position for about 3 seconds, and then coming back to the starting position. Go one more on the left, hold that for 3 seconds, and then coming back to the starting position. Okay, so this can be performed with no resistance. If you feel like you're pretty good with it and you want a little bit more of a challenge, feel free to always add a resistance band. It's the same movement, but you'll just hold onto the band out in front and then rotating to the side, okay? When starting this exercise, start off with about 10 repetitions because it's a mobility exercise, 3 sets, and you want to be repeating that on both sides of the body, okay? As you get more confident with it and comfortable, add the resistance in, turn it into a bit of a mobility and a strength exercise, and it will really help support your mid to upper back. I'm now going to demonstrate how to do a ball release behind the back of your shoulder blades. This is great to take the tension off the upper traps and give you a bit of symptomatic relief, particularly if you're having upper back pain or any headaches or migraines, okay? So to start off with, what you need is a ball. I have a spiky ball for here. You can use a tennis ball, a lacrosse ball, or if you're really game, you can use a golf ball. It's a little bit firmer, okay? What you want to do, you can perform this on the ground or against the wall. For the demonstration today, I'm going to use the floor. What you want to do is place the ball behind your shoulder blades, in between where your spine is and the shoulder blade. There's a nice fleshy bit there. You want to be placing the ball, okay? So to start off with, have your feet flat on the ground, knees bent. Try to find a place where the ball can sit in between that fleshy part, and you want to be laying on your back, finding a point of tension, okay? You may need to roll around a little bit to find that, but once you find it, you can sink into the tissue, hold that. You can hold it for any time you like, but sort of hit anywhere between 30 to 45 seconds to get the optimal release through the top of your traps. And then you can repeat that on both sides, and as many points you find that